Hello, my name is Jeff Steffens. I'm a data coordinator at the Missouri Cancer Registry and Research Center. This presentation slides were created by Babette Neckert, data coordinator, education coordinator. Today, I'm going to educate cancer registrars about vulvar cancer and HPV. My intent is not to give medical advice to the general public. The Missouri Cancer Registry and Research Center is housed at the campus of the University of Missouri in Columbia, Missouri. The Missouri Cancer Registry and Research Center is supported in part by a cooperative agreement between the Centers of Disease Control and the Missouri Department of Health and Senior Services, and a surveillance contract between the DHSS and the University of Missouri. Missouri is a research state for SEER. Vulvar cancer is a rare cancer that starts in the tissues of the vulva. It is a type of cancer that occurs on the outer surfaces of the female genitalia. The vulva is an area of skin that surrounds the urethra and vagina, including the clitoris and labia. Having a vulvar intraepithelial neoplasia or HPV infection can increase the risk of vulvar cancer. An area of VIN may look different from normal vulvar skin. It is often thicker and lighter than normal skin around it. However, an area of VIN can also appear red, pink, or darker than the surrounding skin. Almost all women with invasive vulvar cancers will have symptoms. These can include an area of the vulva that looks different from normal. It can be lighter or darker than normal skin around it, or look red or pink. A lump or bump, which can be red, pink, or white and can have a wart-like or raw surface or feel rough or thick. Thickening of the skin of the vulva. Itching, pain or burning, bleeding or discharge not related to the normal menstrual period. An open sore, especially if it lasts for a month or more. Varicose carcinoma, a subtype of invasive squamous cell vulvar cancer, looks cauliflower-like, growth similar to genital warts. HPV is a group of more than 200 related viruses, some of which are spread throughout the vaginal, anal, and oral sex. Sexually transmitted HPV types fall into two groups, low and high risk. High risk HPVs can cause several types of cancer. There are 12 high risk HPV types: HPV 16, 18, 31, 33, 35, 39, 45, 51, 52, 56, 58, and 59. Two of these types, HPV 16 and HPV 18, are responsible for most HPV-related cancers. Low-risk HPV types rarely cause cancer, although few low-risk HPV types can cause warts on or around the genitals, anus, mouth, or throat. HPV infection is common. Nearly all sexually active people, regardless of their sex, gender identity, or sexual orientation, are infected with an HPV within months to a few years of becoming sexually active. Around half of these infections are with a high-risk HPV type. High-risk HPV infections that persist can cause cancer. Sometimes HPV infections are not successfully controlled by your immune system. When a high-risk HPV infection persists for many years, it can lead to cell changes that, if untreated, make it worse over time and become a precancerous and then cancerous. HPV can cause 6 types of cancer. These include anal cancer, cervical cancer, oropharyngeal cancer, penile cancer, vaginal cancer, and vulvar cancer. HPV vaccination can prevent cancer. HPV vaccines can prevent infection with disease-causing HPV types, preventing many HPV-related cancers and cases of genital warts. Long-lasting infections with high-risk HPVs can cause cancer in parts of the body where HPV infects cells. HPV infects the thin, flat cells, squamous cells, that line the inner surfaces of these organs. Most HPV-related cancers are called squamous cell carcinomas. Some cervical cancers come from the HPV infection of glandular cells in the cervix and are called adenocarcinomas. Virtually all cervical cancers are caused by HPV. Most vaginal cancer, 75%, is caused by HPV. Most vulvar cancers, 69%, is caused by HPV, and over 90% of anal cancers is caused by HPV. Infection with high-risk HPV does not cause symptoms. However, depending on the site of the infection, the precancers and cancers caused by high-risk HPV infection that persists for many years may cause symptoms such as lumps, bleeding, and pain. Normal cells may become cancer cells. Before cancer cells form in tissues of the body, the cells go through abnormal changes called hyperplasia and dysplasia. Hyperplasia and dysplasia may or may not become cancer. Research has found that it can take 5 to 10 years for HPV-infected cells to develop into precancers and about 20 years to develop into cancer. Once high-risk HPV infects cells, it interferes with the ways in which these cells replicate, divide, and communicate with one another, causing infected cells to multiply in an uncontrolled manner. These infected cells are usually recognized and controlled by the immune system. However, sometimes the infected cells remain and continue to grow, eventually forming an area of precancerous cells that, if not treated, can become cancer. Here we're going to talk about the HPV vaccine. The Gardasil 9 vaccine is approved by the FDA. The CDC suggests routine HPV vaccination at age 11 or 12. The ideal age for vaccination is before a person is sexually active. Once a person gets HPV, the vaccine may not be as effective. That's because the vaccine's goal is to prevent a new infection. If a person has the virus, the vaccine may not help the body clear out the virus. The HPV vaccine protects against genital warts and most cases of cervical cancer. It protects against cancer of the vagina, vulva, penis, or anus caused by HPV. The HPV vaccine also protects against mouth, throat, head, and neck cancers caused by HPV. The vaccine gives the body a safe way to build immune system awareness of some HPV strains. This means the body has an easier time clearing out these strains of the virus if a person catches them later. Here's an ICDO 3.2 update effective January 1st, 2022. Use the HPV-related histology codes 8085 squamous cell carcinoma HPV positive and 8086 squamous cell carcinoma HPV negative for cervical cancers beginning with cases diagnosed 1121. Use these HPV-related histology codes for vagina and vulva beginning with cases diagnosed 1122. Here's a 2024 update for solid tumor rules, other sites of vulva histologies. 2024 update. Vulva coding note. P16 is a valid test to determine HPV status and can be used to code HPV-associated and HPV-independent histologies. There is a new SSDI for vulva primaries dealing with P16 in 2024. The P16 biomarker is overexpressed in response to HPV. It is therefore a surrogate marker for HPV disease. Patients with HPV have a different survival or outcome, so it is important to be able to distinguish this by documenting the P16 results. Testing is performed by IHC, which is inexpensive and has near universal availability. P16 is a tumor suppressor protein, also known as cyclin-dependent kinase inhibitor 2A. Coding instructions and codes. Note 1. This STI is effective for diagnosis years 2024 plus. For cases diagnosed 2018 through 2023, leave this SSDI blank. Code 0 for P16 expression of weak intensity or limited distribution. Note 3. Data item must be based on testing results for P16 overexpression. Testing for HPV by DNA, mRNA, antibody, or other methods should not be coded in this data item. Do not confuse P16 with HPV, which is a specific strain of virus. A statement of a patient being HPV positive or negative is not enough to code this data item. FIGO stage vulva. Note 1. There must be a statement about FIGO stage from the managing physician in order to code this data item. Do not code FIGO stage based on pathology report. Do not code FIGO stage based only on TNM. If FIGO is not included with a stated stage, then do not assume it is a FIGO stage. Note 2. FIGO stage is not the same thing as FIGO grade. Only code FIGO stage in this field, do not code FIGO grade. Code FIGO grade in the grade fields. Note 3. If there's more than one FIGO stage provided from the clinical and pathological workup, code the most extensive FIGO stage. And note 4. The FIGO stage definitions do not include stage 0. code 97 for any non-invasive neoplasm. The following squamous intraepithelial neoplasia grade 3 is reportable in Missouri as an MP requirement. VIN3s of the anus, VIN3s of the vulva, VAIN3s of the vagina. Class of case 34 and 36, which were previously non-reportable in Missouri, have been changed to reportable. These are cases reportable to the Missouri Cancer Registry, but not the COC. Examples are breast LCIS, AN3s, FIN3s, and VAIN3s. We hope this solves some of the reporting issues for COC facilities. Please make sure your software is set to submit these cases. These are the resources for this presentation. This concludes this video on vulvar cancer and HPV. If you have any questions, please contact the Missouri Cancer Registry and Research Center at one of these numbers. Thank you for listening.